Hey everybody, I hope you are well. It's hot. I noticed that as soon as I turn my car off, it starts to get pretty hot in here. So I hope you're getting somewhere where there's less of a breeze today than yesterday, but somewhere where you can at least be in the shade. Just as a first matter, the cleanup continues in Salisbury and other affected towns. As I sit here, I can hear the chainsaws buzzing pretty much all day long. And I know now that, people are safe, and although I'm learning that some people remain without internet, which is a little surprising to me. And so we're trying to sort that out with providers who've been a little slow. But also those who did experience damage are now, dealing with both damage to their homes and cleanup of debris and trees, and of course loss of food. The costs are starting to hit people, and they are substantial, and they're really hard to deal with. And so we had a briefing from the Department of Emergency Services and Public Protection, and the Department of Consumer Protection and the Department of Insurance briefed municipal and local and state legislators earlier this week, yesterday, to sort of give them an update on what's going on. The first of which is the hard bit of it, which is that we are pretty unlikely to qualify for federal aid, and for a couple reasons. The main reason of which is, or the first reason of which is, in order to qualify for federal aid, we have to hit both a statewide threshold, which in Connecticut is about 6.9 million in damage, and a county threshold, which in Litchfield County is a little over 900,000. And although we might get to the 900,000, we're not there yet, but we might hit that one. We're far from the statewide level, of course, because there's a lot of storms in our area. It's localized, and some of the, even when the damage is more widespread, often for us, as you all know, it hits Massachusetts and New York rather than the rest of Connecticut. So we're really far away from that statewide thing. So we're trying to focus on other ways to provide assistance to people, and at least get them, advice on how to, handle insurance claims and things like that, to make sure to maximize what you have available to you, because those challenges are, costly and painful. I got to go to the last of the, after the storm, some of the July 4th, I missed a couple of July 4th events, but the last couple towns read the Declaration of Independence. And as I have said, it bears listening to, and I've listened to it a bunch of times over the course of the last week or so. And every time I learn something new about that document, or I'm reminded something new about that, the important statements of principle that are in there that bind us together as a country and as citizens and as patriots. So I have enjoyed that, and I hope you got to hear the Declaration get read aloud to you over the last week. Then another thing we're keeping an eye on, as those of us who are trying to keep an eye on what we're going to have to deal with in the remaining months of this year and also next year. And one of those issues, of course, is healthcare costs. And to sort of summarize, what's happening in Connecticut is a version of what's happening across the country. But we've got, first of all, we've had some statistics recently about people who have coverage under the ACA, Obamacare. About 22,000 people in Connecticut enrolled in that coverage lost coverage in the first 6 months of the year, and they may be able to pop back in. They may be getting other coverage, but that's a dramatic increase over the last 6 months of last year. And that's sort of happening in part caused by the expiration of federal subsidies, which kept premiums low for a lot of people in Connecticut, and again throughout the country. Those expired, and rates went up. Connecticut was able to, thanks to the fact that we have pretty responsible budgeting process, we had funds available to invest and to extend some of those subsidies for a while, but we're not going to be able to do it for the long term, and so costs are going up for people. And that means that a lot of people, healthier people, are dropping out, which means the rest of the pool is less healthy, which means their costs are going to go up. And it's a scary situation, and we're trying to figure out. We have directed, as part of our budget this year, the governor to sort of draft a plan for dealing with that going forward. And I expect we will be wrestling with that for many years to come, but certainly in the next year. Because that's happening in the insurance marketplace. A version of that is happening in the Medicaid or Husky environment as well. What's happening there is the federal requirement has new work requirements. And I can't reiterate often enough that in Connecticut, that is not a problem. 80% of Connecticut's, Husky recipients work already. And so that, and the rest we think are probably not, would be exempt from the work requirement in any event. But that is not our problem. The problem is those people who work really hard, often at multiple jobs, don't have time to fill out multiple forms. And so we're trying to make it easier for them. We're trying to identify them ahead of time so they don't drop out, because it has, not only do those people lose coverage, but it also, all of that, both in this in the Husky area and also in the private insurance, when people drop out of coverage, they end up in uncompensated care at our hospitals' emergency rooms. And that, of course, increased costs, which get, of course, passed down to everybody else and hurts our hospitals. So we're trying to get ahead of that as much as possible, but it is really challenging, and we wish we had more support on the federal level, but we do not. On a more joyous note, I hope you're watching the World Cup. I have been watching the World Cup, and it's our family stays on a tight text chain when the games are on. And I know there's a big one, France and Spain this afternoon. I'm cheering for France, and it's provided a moment of joy. And I saw a couple of headlines about the actual Americans are much more hospitable and engaging and welcoming to the foreigners who are coming to root on their teams than the government seems to be at the moment, and that's joyful. And I also want to just note at the end, on a personal note, my college roommate's father just broke the record as the oldest person to summit Mount Kilimanjaro, which he did on his 90th birthday. So there's a little moment of inspiration for all of us. Go Art. I hope you have a good rest of the week, and see you soon.